it's not just new tests that are down right now. Across the state, hospitalizations are declining as well. We wanted to learn more about these trends and what's behind them, so Dr. Jeff Pothof from UW Health is up early to talk us through it all. Good morning, doctor.
Good morning.
Thanks for taking the time. We talked to you last half hour and we touched briefly on the expected surge that public health officials were predicting after Thanksgiving. Have we seen any semblance of that surge?
We haven't seen a surge in patients, and we haven't seen this surge in hospitalizations. So the optimist in all of us thinks that maybe people did get the message, or they know people who were affected by COVID, and they took Thanksgiving off. And for anyone in the community that did that, just a grateful thank you from healthcare workers across the state. We really needed to get those numbers down a little bit. They're still very high, but that slight decrease in numbers makes a big difference.
You just mentioned the number of people who have to go to the hospital with COVID right now. It's down across the state. What's that picture look like here in our area in Dane County?
Our slowdown in hospitalizations was a little bit slower than the rest of the state. We still have very high hospitalization rates here in Dane County. Over the last couple of days, numbers have dropped down just a little bit from that peak. So hopeful as the days continue that lower trend continues here in Dane County too.
We report a lot of numbers every morning. I think it's easy to get lost in them. For example, the DHS says 16% of hospital beds across the state are open right now. I'm curious, what exactly does that number mean if you or one of your loved ones needs to go to the hospital right now? Is there space?
Yeah, I think that's a great question because when we say, what percent of beds are open, it really is helpful to know, is that just physical beds? Is that beds that have staff to run them? Because without staff, the bed's not much use. Hospitals are still very full. It's likely if you need to get into a hospital, there might be a slight delay from the time that you're identified as needing admission to when you can get in. For the most part, hospitals have been able to make things fit. There are still people who aren't getting their non-urgent, non-emergent procedures done. So we'd like to see numbers come down so we can begin doing that again. But we're close to really full, but we've come back a little bit where I think that immediate threat is a bit lessened.
Some good perspective, some good context there. Dr. Pothof, thanks so much for waking up early and talking us through some of this.
You bet.